In this last section, we're going to talk about fluid requirements, mostly focusing on crystalloids. As I mentioned before, colloids mostly stay intravascularly, so they're going to have a different value whenever we talk about this. There are two parts to fluid management. First, you have resuscitation. In resuscitation, you're taking a patient from being hypovolemic to euvolemic, meaning that you're trying to take away all the patient's fluid loss, or trying to replace all the patient's fluid losses that they had before. Versus in the maintenance phase, you're just keeping a patient euvolemic. And we're trying to maintain them once we have done the replacement, or if they didn't need replacement, and we just want to make sure that they're getting the amount of fluid that they need to avoid volume depletion. So for an example, if a patient is in the hospital and they can't take anything by mouth, they may need maintenance fluids in order to maintain the amount of volume that they need. Versus if a patient comes in and they've lost a lot of blood, they may be hypovolemic and they may need fluid resuscitation first, and then once we resuscitate them or give them enough fluid to give back the blood that they had lost, then they would be in the maintenance phase. So again, it comes in two different phases. Now, in the resuscitation phase, typically what happens is the patient gets 1 or 2 liters. We see if they respond, and then they get 1 or 2 more liters. There's not a real exact math to it. Versus in the maintenance phase, we do calculate to try to see what kind of fluid requirements the patient needs. And there's 2 major ways you can do that. You can either use this base equation of 30 to 40 milliliters per kilogram per day, or use what's called the Holiday-Seeker equation. The Holiday-Seeker equation is really nice because it does take the patient's age into account. And that way, as patients get older, they're at increased risk for pulmonary edema. So this actually helps keep the patient, or helps us keep that in mind whenever we're calculating it for the patient. The Holiday-Seeker equation is an equation that is on your equation sheet, and it does calculate, just like when we do 30 milliliters per kilogram per day, the daily fluid requirements. So, if you have a 50-year-old or somebody who is less than 50 years old, then we use the equation 1,500 milliliters times 20 milliliters per kilogram for every kilogram over 20 kilograms. So what you can do is just say that this is 1,500 milliliters plus 20 milliliters per kilogram times the patient's weight in kilograms minus 20. Versus if you're using the 50 milliliters, or if they're over 50 years old, you'll do 1,500 milliliters plus 15 milliliters per kilogram. Notice how this is a lower value because you have the increased risk for pulmonary edema or overall edema, times patient's weight in kilograms minus 20, because every kilogram over 20 kilograms. This gives you the daily fluid requirements. If you do need to do the hourly fluid requirements, which is what most of our pumps are calculated to, then you just have to divide it by 24 hours. There are certain patients that may need more than what we calculated right there. So that includes patients that are having ongoing losses, such as fever and sweating. Some of these other reasons include ongoing diarrhea or diuretic use, vomiting, patients that are hyperventilating or requiring mechanical ventilation, or patients that have an ostomy or fluid drainage or fistula drainage. Patients that are already fluid overload or might have slight fluid overload may need lower fluid requirements. Those with cardiac failure, patients with renal failure, and those with SIADH. Let's do an example calculation. So we're going to calculate the total fluid requirements for the patient that based on their total daily and per hour requirements. Let's do the Holiday-Seeker equation first. So this is a 60-year-old male that is 70 kilograms. So they get the equation for those that are over 50 years old. And so that equals 1,500 milliliters per kilogram plus 15 milliliters per kilogram for every kilogram over 20 kilograms. So we'll just do this as 70 kilograms minus 20 kilograms, because every kilogram over 20 kilograms. So that gives us 50 here. So that should equal 1,500 milliliters plus 1,500 milliliters per kilogram times 50, which equals 2,250 milliliters. Remember, this is per day. In my question, I asked for you to do both daily and per hour. So I want you guys to go ahead and try to calculate the per hour. So that would be 2,250, sorry, divided by 24 hours in a day. And that should give you 93.75 milliliters per hour. Now, if I were to use the 30 to 40 milliliters per kilogram per day, in practice, I typically will either pick a middle value, do both of them, and see what my range is, or pick a lower or higher value depending on some of those factors that I talked about before. For today, let's go ahead and do both. On an exam, I would tell you either use 30 or 40, but for our purposes today, let's just do both, just to keep practicing. So, 30 milliliters per kilogram per day, or 40 milliliters per kilogram per day, times the patient's weight, so that's 70 kilograms. So that's going to give me 2,100 milliliters per day. Kilograms are going to cancel out, right? Or 2,800 milliliters per day. Again, the kilograms cancel out. You'll see here that this range kind of falls within that holiday seeker equation as well. So I did ask for the per hour, so let's see what the per hour is. So 2,100 milliliters per day divided by 24 hours in a day. That should give me 87.5 versus 2,800 milliliters per day divided by 24 liters per day. If you calculate that, that should give you right at 116.667. And both of these are milliliters per hour. And that's typically what our pumps are actually programmed towards. Now, you might be like, Dr. Joyner, which one of these values would you use in clinical practice? Because if you look at it, 87.5 versus 93.75 versus 116, that seems pretty exact. So typically these pumps are programmed at 25 milliliter per hour intervals. So for that reason, it would be 75, 100, 125, or 150 would be kind of some of the options that I typically will use. So whenever I calculate like this, what I'll do is kind of pick a number in the middle of all these values. So that being said, most likely this patient would receive 100 milliliters per hour. For our purposes, for exam purposes, and so I know you guys grasp this concept, you guys wouldn't have to do this. You guys can just, you guys wouldn't have to make this kind of judgment call. You guys can just calculate it. And that's what I need you to be able to do.